So some of the advice that I would give to a new state health official is to, first of all, remember it's about the issues and the system. It's not about you. So, do your best, and sometimes it's going to work and sometimes it's not. So, because this is hard work over the long haul. The second is to be transparent in everything you do. Be ready to read about it in the paper tomorrow, or be able to have a conversation with your mom or your grandmom about it. And let that be one of your guides. Surround yourself with good people. And be sure that you are supporting your leadership to the very best extent that you can. Work on your communication skills and build those partnerships in the community along with the team that you have inside, because that's how you're going to be able to go forward.
The first thing to remember is these are temp jobs. And there are many things that are going to come to you that are unanticipated. And so you need to decide what 2 or 3 things that you want to do so that at the end of your tenure, whatever it is, however long or however short it is, that you feel that you've accomplished what you went to do the job for. And recognize that what's going to be layered on top of that is your governor or mayor's priorities, depending on where you are. And the stuff that just happens, that the legislature gives you and fate puts in your way. But if you focus on the few things you want to do and get your team focused around that and deal with the mandates that you're given, you'll be quite successful.
One thing I would recommend is recognizing you hold the position for a short period of time. And that you have the potential to make a difference, pick a few priorities, work on those, and enjoy yourself. The second thing I'd say is have a support system. That can be your family, your friends, it can be your peers through ASTHO, but you need a support system. You need people who are there to help you think things through, to remind you you're a good human being on a really bad day, and also to keep you humble and remind you that if people are standing up and applauding you, it's really more about the position than you. You need a reality check from people who love you and care about you. And finally, I would say it's good to think about the future. Too many state health officials begin to think about what next at the point they're no longer a state health official. It's not easy to think about the future when you're in the midst of such an important role, but it's worthwhile doing that. And again, I think ASTHO and former state health officials who've made that transition can be very helpful in terms of helping think about what their transition was like, what their other career possibilities might be. You want to make sure that you're not caught by surprise and find yourself in a difficult situation at the end of your tenure.
Again, it depends on your state environment, but be that subject matter expert and be that good manager. But also learn how to lead up whoever you're reporting to. In my case, it was the secretary in a big umbrella agency called Health and Human Services. You may be reporting directly to the governor and maybe sitting on that cabinet.
For the next generation of public health leaders, my message would be certainly follow your heart. Do what you are passionate about. It's absolutely what has led me to this role. But then also think outside the box. Don't consider yourself to be the only one that's thinking that, or start from scratch, but look around you to see how you can leverage the partners who are there. Because being effective within public health, the one thing it requires is for you to not do it by yourself. So the ability to know how to engage partners, how to speak the language that they speak so that we can get the outcomes is what I would encourage future public health leaders to focus on, so that we can get some new outcomes and better results for the populations that we serve.
Well, it's one of the most enjoyable jobs I've ever had. It was really fun. It was challenging because of all the politics and the lack of funding. It was a continual effort. It's like being head of a foundation. You're continually trying to raise money, a nonprofit. And use ASTHO, use the resources of ASTHO. It's a great way to learn quickly what lies ahead and the networking opportunities. And get to know the state health officers in the neighboring states because you have cross-border issues. And another important one is work closely with your local health department partners. In maybe 10 of the states, it's unified and the locals are state employees. That's the way it is in Florida. That makes it easier. You're all in the same agency. But if not, you really need to get to know them. I visited all 112 local public health agencies in Missouri. It took 2.5 years, I think. I created a partnership council with 3 large, 3 medium, and 3 small size health department reps. We met monthly or quarterly, I can't remember, but that's where we dealt with challenging issues of funding formulas, funding distribution, big priority areas. HIV/AIDS was a big one for me back then in the late 80s. And then you can count on them as allies instead of opponents. And they were independent in Missouri, they have their own relationship with legislators. So when I'd go into town to visit the local public health agency, I'd also visit the legislator in his or her office locally. And I remember one time I was telling the governor about this, John Ashcroft. I had a very good relationship with John. I said, I'm trying to visit all the local public health agencies in the state. He looked at me and he said, what are you running for? I said, well, nothing, Governor. He was joking. Have a good relationship with your governor. If you report directly to him, you may not report to him. And if you don't report to the governor, have a very good relationship with your agency secretary or the leader of your umbrella agency. And then, if possible, also have a good relationship with legislators or someone in the governor's office.
So the relationship between public health and private medicine is one that, quite frankly, has intrigued me my entire career. I think we miss opportunities all the time with private medicine and public health. And that's when we think about the leadership of state health officers and what they can bring to the table is forging a strong relationship with the hospital association at the state level, and then with CEOs. So a quick story. I was state health officer, had been state health officer in Indiana, 2 or 3 years by this point. And there was something I had a question about, and I started calling CEOs of hospitals. And I called one particular CEO in a moderate-sized town who'd been the CEO of this hospital for 30 years. And he said, this is the first time state health officers ever picked up the phone to talk to me. And he was thrilled. He was thrilled with the call. We ended up probably talking an hour. We covered all kinds of issues. And he became one of the greatest advocates for public health during my tenure and after. So picking up the phone, talking at that top leader, the state health officer, the beauty, and I love this part of the job, was that, quite frankly, anybody would take my phone call. I mean, CEOs of companies, CEOs of hospitals, it didn't matter. As the state health officer, folks would take your call because they knew you worked for the governor and they had an interest in that. Use that wisely because we need to forge more relationships. And then if it's starting at the top, then you can engage the local health officer to work with the local hospitals and with the medical staff. One of the things I did as state health officer is I started very strategic communications out to all licensed professionals. And it would depend. Sometimes it would only be to the physicians. Sometimes it would be to the pharmacists, nurses, and so forth. And some other state health officers have followed suit with that. That's another bully pulpit opportunity that state health officers have. And if new state health officers are coming into the job and that's not established in your state, seize that opportunity, but be strategic about it. You don't want to overwhelm the practicing physicians with communications. And then, actually, we started a medicine and public health day. It was the it was the commissioner's, public health and medicine day, and I actually got the residency programs to close down for the day, have the faculty cover their patients, and we bring residents in to highlight all the things that had happened in public health in Indiana for a year. For looking back and the year before, what were the issues that medicine should care about that public health had been managing, those kinds of things. It was a really robust and fun day.
It is, without a question, one of the most exciting, rewarding jobs that you can have. Personally, you get a sense of satisfaction. You get the slings and arrows. Sometimes you get the arrows, especially when you do things that they consider maybe a little bit out of ordinary. But what you do is you get the satisfaction of serving the public. And to me, I'm not being patriotic, but I happen to think that's a very high calling.
Your opportunity when you're a state health official is something that not very many people share. So reach out to your colleagues, number one. Create whatever friendships it is that you will create, but use them to help you through the tough times. Secondly, relationships are everything. All else is derivative, whether it's with your governor's staff, whether it's with the legislature and the legislative staff, or the congressional staff in Washington, D.C., that we have to have those relationships in order to have the policy discussions that we need to have when we're the state health official. And the other one is to pay attention to your workforce. Give them a good place to work. If they're not in great buildings, help them get into great buildings. If they need infrastructure updates, and whether it's your IT department or whatever the case is, give them good tools to work with, but also provide the kind of leadership that helps them thrive and create a learning opportunity for them all the time and be a lifelong learning organization.
So if I were to give a message to someone who is this new state health official, having told them how they need to work with other agencies, how they need to work within the agencies, how their funds are going to be restricted, this is the best job in the world. This will be some of the best times of your life. Take time to pause, to enjoy the moment, and to recognize the importance of what you're doing and how rewarding this can be. Because it's too easy to focus on the challenges and too easy to focus on the problems and that senator who's been giving you grief. But think about what you've been doing and what you can do. And that, I think, is really the joy of this position.
As a new show, there's a lot of pressure for you to move forward. And I think unfairly, you think you have to be perfect. And you're not. And the quicker you get over the idea that everything that you do, whether it's every decision you make or every speech that you do or decision you move forward on, it's not going to be perfect. We need to recognize that no matter how smart you are, you don't know everything. And most importantly, there's help around the corner. Call on colleagues, other state health officials, ASTO, members of the Alumni Association. Everyone is here to help. We have a vested interest in your success. And as a state health official, a new state health official, you're entering a part of your life which I think will be the most exciting, most productive, perhaps in some cases the most frustrating job you've ever had. But it also is the most rewarding, because when you can look in the eye of that child or that dad or mom that didn't have hope before, that because of something you have done, have a new feeling of hope and optimism for their life, then it's all worth it.